Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. On June 14, we will observe World Blood Donors Day under the theme Give Blood, Give Plasma, Share Life, Share Often. Joining me on the program today is Dr. Pedro Lewis, the Director of the National Blood Transfusion Services. Welcome to the program, Dr. Pedro. Thank you for joining me today. World Blood Donors Day is coming up on June 14, and we always look forward to this day because it's a day whereby we celebrate our donors and so forth. Could you tell us about the importance of this day and provide a bit of background with regards?
Yeah, so Guyana have been celebrating this particular day since 1989, where we established, that there's one blood bank, and we have several collection sites around the country or across Guyana. So of course everybody knows the Central Blood Bank is located in at Lama East Street in Georgetown Public Hospital, and we have our collection sites in Region 2, 3, 6, 9, and 10. So these regions basically collect blood and they send it here at Central to be processed. So there's one blood bank, very important. This is the gold standard. This is where everybody wants to be, to just have one blood bank where you have all the processing and testing being done, and then you distribute to private and public health facilities. So World Blood Donors Day has been celebrated here in Guyana since 1989. It's been celebrated around the world even before then. And this day, of course, is very important. The slogan for this year, of course, which has been established by PAHO WHO, is to give blood, give plasma, right? Give life, and do it frequently, right? Very important slogan. And this year, they stress on not only the donation of blood, but the donation of plasma. We have learned that, plasma, we call it the gold product in the sense that from plasma, you could have hemoderivatives, things like factor 8, factor 9, fibrinogen, albumin, which is being used for various diseases, various conditions across the world in the different health facilities. And of course, these products are very expensive. And the plasma, which is the prime product, comes from the blood bank. Not only in different countries, not only in Canada, United States, in Latin America also. So from this plasma, they could make these hemoderivatives, which is very critical, especially in chronic disease. So this year also, with the World Health Organization focus, Latin American countries, Guyana, the focus this year is on chronic illnesses, right? How we support persons with chronic diseases that depends on the blood bank for these products so that could give them a normal life. And we're speaking here about sickle cell disease patients. We're speaking here about thalassemia patients. We're speaking here of chronic kidney disease patients who depends on us for blood frequently. Every 2 months, every 3 months, they will need blood to keep them going. Some persons go to school, right? Some persons work for them to have a normal life. And this reality, not only in Guyana, but across the world. People depend on blood and blood products. So the focus here is on those patients this year. Also, World Blood Donors Day, we know it is very important that we celebrate the persons who give these products, who take their time off 50 minutes a day. Yesterday we had an individual who came on his birthday and gave blood, person who do those kind of things and, take time off and they come and give the blood. It's very important that you put aside a day and you celebrate them. It also uses the to give awareness to individuals who have never donated before to start donating blood, right? We tell them the importance of doing it so that they could make a start on this day, right? It also is important that you send this message across countries who basically lag behind in terms of having a blood program in the country. To give awareness to the government, for them to champion the cause of this very important process, right? And make it a culture in the country so that person could donate, so that the individual who have these illnesses, chronic illnesses, could benefit, right? So this is the day for us to do all of this, and it's very important that you start it from a community level, right? Very important that you start it from the community level. You have the conversation in school, you have the conversation in government and non-governmental organizations, right? So person could, start this very important gesture of giving blood.
Thank you, Dr. Pedro. I know that you guys always have great activities and initiatives planned for each year's observance. Tell us what we can look forward to this year. What do you guys have planned?
Well, of course, like every other year, this year we will, of course, have activity that we could, call out some of the organizations, award the organizations who had blood drives with us, the past year or two. We cannot give every organizations, so we usually choose organizations randomly. We will, award them. Also, we have individuals who donated blood very frequently. We also give them something, they could put in their office, could put at home. And most importantly, why we do this, we're not just doing it, for just doing its sake. We want persons to see it, and and it could encourage others to start giving blood.
Give blood, save lives. 1 unit can breathe life, make someone smile. Donate blood and heal a life today. Give blood, save lives. You just have to give and save lives. A message from the National Blood Transfusion Services. Be a good Samaritan, be a hero. Donate blood, save lives. For more information, contact us on 223-7182 or 226-9022.
In 10 minutes, you could save 3 lives with just 1 unit of blood. Here's how. Each unit you donate is divided into the 3 components: red blood cells, plasma, and platelets. Each of these components have different uses too, treating different diseases, car accidents and burn victims, trauma patients, open heart surgeries, and so much more. Car accident victims and organ transplants require at least 50 units of blood. Burn victims need at least 20 units. Open heart surgeries require at least 10 units of blood. It starts with you and 1 single unit. So let's join in making the world a better place. 1 pint at a time, 1 life at a time.
For persons who are listening and viewing the program and they're wondering, how can I become a voluntary blood donor? What is that process like, and what are the first steps?
Very important question. So, giving blood, very safe. I never heard of anybody die because they give blood. You could start from age 16, of course, with parental consent. From age 17 to 65, you could donate every 57 days, or we say every 2 months, you could come and donate. The process is simple. We take 15 minutes. We basically screen you by asking you questions to make sure that when we take this blood from you, that you're safe, right? And of course, we look at the recipient interest in this case. This is the reason why we ask you questions. And of course, we will test the blood afterwards. But very importantly is the questions, because you want to make sure that you're not at risk of having a particular infection.
How is blood stored?
So I see this question as very important, because a lot of persons think, when you give blood today, it lasts a lifetime. Sorry, this is not the case. This is the reason why, there's a special department in the Ministry of Health that is responsible of keep collecting blood. It's a task, it could get bored easily, but it's something that we love here at the National Blood Transfusion Service, and unfortunately, this is something that we have to continue doing. The thing is that when you give blood, it only lasts for 35 to 42 days max, and this is based on the type of anticoagulant that you use. for preserve the blood and blood products. Of course, it a whole blood in a sense is it got various components. We have to separate it, and each one of the components is being stored differently. For example, packed cells that is being used very frequently is stored between 2 to 8 degrees C in a refrigerator, and it still lasts for a max 42 days. But these units it go rapidly because now Guyana is developing. We have a lot of advanced procedures being done like cardiac surgeries, and cardiac surgeries now will now only be done by Georgetown Public Hospitals. We see cardiac surgeries now being done privately, and those sort of patients utilize a lot of blood and blood products. So we got to keep collecting, so that we could have a healthy nation.
Thank you so much, Dr. Pedro, for emphasizing that donating blood once wouldn't last for a lifetime, and so it's important for persons to donate frequently. Now, once a person would have donated for the first time, how or when can they come back again to donate? How often do they have to donate blood?
Yeah, and very importantly, I think this is one of the objectives too of celebrating World Blood Donors Day that I miss, is that when somebody come and donate once, it's very important that you make them comfortable. It's very important that you give them a good experience the first time, right? And we must highlight that so that they could come again and donate. And there's our focus here at the National Blood Transfusion Service, and not only for the first-time donors, for the regular donors also, right? We want to make you comfortable the first time so that you could come. And you could come after you donate. Once you could come and donate 2 months later after the donation. Even if it's your first-time donor, or you're a regular donor.
What kind of patient conditions do you guys cater to? I know that you cater to patients who do frequent blood transfusion, but are there any others?
Yeah, correct. Good questions too. Yeah, of course, this year, our focus is on chronic disease in terms of the theme for World Blood Donors Day celebration this year. But not only chronic disease, we have trauma patients that comes frequently at the hospital, but very, very importantly, obstetrics patients, mothers that bleed. If you have a bleeding mother in front of you, she needs blood like tomorrow. And she not only gonna need 1 unit of blood, she will need 6, 7, 8 units of blood. And also, these are the patients that most of the time they will activate a massive transfusion protocol, which calls for a lot of packed cells and not red blood cells alone. You will need platelets, you will need plasma, you will need cryoprecipitate for these patients. And every so often we will have those cases. So those types of patients receive a lot of blood. And everybody knows, it's very important that you focus on your maternity patients, because if you lose a mother, you will lose the entire family. Right? Family become dysfunctional and so on. So, this is the reason why a lot of focus is being placed on maternity patients.
You mentioned platelets. Tell us about that. What are they?
So platelets, of course, is a component of the whole blood that a person may donate. And you cannot only get it from whole blood, you could get it from apheresis procedures, where you just collect platelets alone from the individual and you give them back the other products like the packed cell and the plasma and so on. So platelets could be made by PRP, we call platelets-rich plasma, where you centrifuge your whole blood, then you centrifuge your plasma, right? And then you will get platelets from the plasma, which is platelets-rich plasma. But you could also get platelets from apheresis. And the importance of this is mainly the kind of patient that we issue platelets a lot to is the leukemia patients who want to go chemotherapy, right? And a patient who will need also important procedure because they might be at risk of bleeding. So we will need platelets for those particular patients. Mostly children.
Children. So, what are some of the strategies and implementations that you guys would have adopted over the last few years to increase blood donations across the regions?
Nice question. I love this question because, I'm at the National Blood Transfusion come December, going to be 8 years. And, being here for 8 years, you kind of learn certain target areas in the country where you will get specific groups from those individuals. All groups are important. I wouldn't put that aside. All blood groups are important. When we work here at the National Blood Transfusion, we look for all groups of persons. A few years back, our focus mainly was in Region 4, Region 6, Region 3 to a less extent. But now you could see us collecting blood from Region 9, Region 7, right, where we collect a lot of O-positive blood from those regions. And those blood, of course, goes to the patient here. And the important reason of doing that is that you want to get blood for majority of your patients because you will find 7 out of 10 of the patients that come to the hospital are O-positive, right? So you got to make sure that not only save blood that you get in, you must get the quantity, right? Besides that, going to these areas, you must have, a community sense of working. You must educate person at the community level, right? And, at least inform them of the importance of donating blood, and we see that works a lot, right? And by doing that, I increase our quantity of blood units in the system.
For companies and organizations who wish to partner or collaborate with the National Blood Transfusion Services to do blood drives, how can this be done?
Yeah, and as you know, as it stands now, we have over 400 different organizations that participate in blood collection at the National Blood Transfusion. Of course, some person will decide to come in-house, but most of the time we will go to the organization and collect the blood. They will just, call us. 223-7182 is our number, and these organizations will call us. They will organize if it's the first time. Most of them, if it's the first time, they will organize a sensitization session where we will educate the staff, and most of the time we encourage that too, because we don't want to go there and you just collect a few units. We will educate the staff, and then we will have a census of how much persons willing to donate, and then we will return on a date given by the organization that is suitable for them, right? And we will do our blood collection, right? And on the blood collection, we will work with all our materials, include vitamins and snack for those donors. Most of the time, the organization will provide snacks, or we work with our vitamins, right? This particular activity, we will encourage organizations to do. If you want to put activity to put on your calendar, make sure you put blood drive first, right? It doesn't cost you anything, right? All we need is, to have a sensitization with the staff, right? Your time and the space, and we will be there to collect the blood.
Thank you so much, Dr. Pedro. But before we end today's program, since we're observing World Blood Donors Day, do you have any words of encouragement to our listening and viewing audience?
Yes, it's very important that I use this platform to, thank our donors. This year is very important to note, and I think this year, at this point of time, like no other year before, we had collected most amount of blood to date, right? We are averaging about 1,000 units a month, which is, which put us, in an excellent platform. This is something that we want to maintain going forward, right? We have covered, You know, I don't have the numbers, but like I said before, there's so many heart surgeries. Usually we'll have heart surgeries probably twice or thrice a year. Now we have heart surgeries probably 2 times a month, right? And, you know, without blood on standby, you cannot do those surgeries. And we were able to support all of those heart surgeries to date, right? Which is very, very, very important. So it's very important that we thank the voluntary donors out there. Very important. And we just want to encourage them to spread the word, right? Send the message out there. If you have a family, let them know. If you have children, you educate them. So when they reach 16, they will be willing to donate. If you're part of an organization, no matter what organization, if you're part of a church, mandir, mosque, you know, encourage the organization to have a blood drive. You reach somebody on the road, you know, encourage those persons to donate blood. And not just, you know, healthy person, not because you're not healthy or you're an individual that just receiving blood, you know, you just keep back that information. If you're a person that receives blood, you also need to spread the message. You know, tell healthy persons, you know, how blood benefits you, how it helps your life, how it keeps you healthy, how it makes you go to school, how it makes you get a job, so that, you know, those persons could now come at the blood bank and donate, right? Spread the word.
This has brought us to the end of our program for today. I'm your host, Alicia Martin, saying goodbye for now.